You and me. Run it. Run it!
1. Case scenario. A 32-year-old woman at 38 weeks gestation presents for a routine checkup. On abdominal palpation, her abdomen appears asymmetrical, and the fundal height is significantly less than expected for her gestational age. The pelvic brim feels empty, and the fetal head is palpated in the iliac fossa. What is the suspected diagnosis and what does it entail? The suspected diagnosis is an abnormal lie, specifically a transverse or oblique lie. An abnormal lie occurs when the long axis of the foetus is not parallel to the mother's long axis. In a transverse lie, the foetal spine is perpendicular to the maternal spine. 2. Case scenario. A primigravida in active labor is examined. Vaginal examination reveals a high, deflexed head where the anterior fontanelle is felt more easily than the posterior fontanelle. Abdominal examination shows a flattened appearance. Which malposition is most likely? The patient is most likely presenting with an occipito-posterior (OP) position. This malposition occurs when the head engages normally, but the occiput rotates posteriorly rather than anteriorly, often associated with an android or anthropoid pelvis. 3. Case scenario. A woman at term is found to have a foetus in a transverse lie. What is the definitive management plan if she goes into labor? The definitive management for a transverse lie is a cesarean section, which should ideally be performed before the onset of labor to avoid complications like shoulder presentation. 4. Case scenario. During a vaginal examination of a patient in labor, the clinician palpates the supraorbital ridges, the nose alinarsi, and the chin, mentum. The chin is noted to be in the posterior quadrant of the maternal pelvis. Can this patient deliver vaginally? No. Vaginal delivery is impossible if the chin is in a mento-posterior position. While vaginal delivery is possible if the chin is mento-anterior, a mento-posterior position prevents the necessary extension over the perineum, requiring a cesarean section. 5. Case scenario. A patient's ultrasound at 37 weeks reveals a brow presentation. The presenting diameter is measured at 13 centimeters. Why is vaginal delivery contraindicated in this case? Vaginal delivery is contraindicated because the occipitomental, mento-vertical diameter of 13 centimeters is too large to permit engagement in a maternal pelvic cavity that typically has a diameter of 12 centimeters. 6. Case scenario. A multiparous woman is diagnosed with an unstable lie at 37 weeks. The clinician decides on expectant management. What is the rationale for this in a multipara? In multiparous women, an unstable lie often corrects itself into a longitudinal lie during early labor, provided the membranes remain intact. However, the general rule for management is usually delivery by cesarean section unless close monitoring by an experienced doctor is available. 7. Case scenario. During an abdominal exam, the clinician palpates the foetal head at the fundus and hears the foetal heart rate above the umbilicus. The lower pole of the uterus feels broad and irregular. What is the most likely presentation? These findings are diagnostic of a breech presentation. The broad, irregular mass in the lower pole represents the buttocks or feet, while the head is located at the fundal pole. 8. Case scenario. A woman at 37 weeks gestation with a breech-presenting foetus is offered external cephalic version ECV. What is this procedure, and what is its success rate? ECV is a manual manipulation performed on the outside of the maternal abdomen to turn the foetus into a head-down, cephalic, position. It is performed at or after 37 weeks by an experienced obstetrician and has a success rate of approximately 60–70%. 9. Case scenario. A patient with a prior cesarean section is found to have a breech presentation at 38 weeks. Is she a candidate for ECV? No. A prior cesarean section is a specific contraindication for external cephalic version ECV. Other contraindications include placenta previa, ruptured membranes, and multiple pregnancy. 10. Case scenario. A clinician is assessing a patient for a planned assisted vaginal breech delivery. What are the minimum criteria regarding the type of breech and parity? For a vaginal breech delivery, the foetus must be in a frank or complete breech position, not footling. Additionally, the source suggests it is typically not an option for primibs, first-time mothers, meaning the patient should be multiparous. 11. Case scenario. A patient in labor with a breech presentation suddenly experiences a rupture of membranes, and the clinician notes a loop of the umbilical cord in the vagina. What is this complication? This is cord prolapse, a serious complication associated with breech pregnancy, particularly in the intrapartum period following the early rupture of membranes. 12. Case scenario. During a difficult breech delivery, there is a delay in the delivery of the aftercoming head. What are the primary risks to the fetus in this situation? The primary risks include asphyxia and intracranial hemorrhage, which can lead to fetal death if the trapping or delay is not resolved quickly. 13. Case scenario. A newborn delivered via assisted breech extraction is noted to have a limp arm that hangs by the side, rotated medially. Which specific birth injury is suspected? The suspected injury is Erb's palsy, which results from damage to the brachial plexus during a difficult breech delivery. 14. Case scenario. A patient is diagnosed with a compound presentation where a fetal hand is felt alongside the head. What is the recommended immediate management of the hand? In most cases, manipulation of the extremity should be avoided as the hand or arm is often spontaneously pulled back as the head descends. If it halts the descent, it may be gently pushed above the pelvic brim. 15. Case scenario. A patient with an occipito-posterior (OP) position is in the second stage of labor. The occiput rotates 1/8 of a circle anteriorly, and the head becomes stuck in the transverse diameter. What is this condition called? This is known as deep transverse arrest, which occurs in unfavorable cases of OP position when there is mild deflection of the fetal head. 16. Case scenario. A clinician is using the Zatukny-Andros breech scoring system to decide on the mode of delivery. The patient receives a score of 3. What is the recommended management? If the Zatukny-Andros score is 0-4, a caesarean delivery is recommended. 17. Case scenario. A patient is diagnosed with an oblique lie where the fetal head is located in the upper quadrant of the uterus, head up. How should this be managed? An oblique lie with the head up should be treated as a breech presentation. If the head were down, a vaginal attempt might be considered, especially in multiparous women. 18. Case scenario. What are the 3 positions considered normal for the fetal head as it exits the birth canal? The 3 normal positions are occipito-anterior, OA, left occipito-anterior, lower, and right occipito-anterior, rower. 19. Case scenario. A 24-year-old woman at 39 weeks is diagnosed with shoulder presentation. What is the underlying cause of this presentation? Shoulder presentation is the result of a transverse or oblique lie of the fetus at the onset of labor. 20. Case scenario. What is the specific term used to describe a breech presentation where the baby's hip joints are flexed but the knee joints are extended? This is known as a frank breech, which accounts for approximately 65% of breech presentations.